A little informal, it's just a workshop for us to gather the information and the facts. And if you would like to begin, is that proper? You want us to flip a coin? Or?
No, I yield. I yield to the gentleman.
I think if you guys want to talk about the format, we can. Otherwise, we'll just dig in. We're going to let each one make the presentation 15, 20 minutes long. We'll have a discussion and then open it up to maybe some questions. So, go ahead.
Okay. Well, Mr. Chairman, and the Council, thank you for allowing me to present about Delta. Again, my name is Tim Beals. I'm the Executive Director of Delta. I'm also a Winslow resident. And so I've got some comments here about Delta and also some thoughts about ambulance operations. Not quite an ambulance 101, but a few points for you to think about as you go forward. So as near as I can tell from the records at Delta, we've served the town of Winslow for 46 years. Served the town for 46 years, working with the fire department cooperatively, with the police department, and certainly with the residents of this community. We also provide continuing education, replenish medical supplies, replace oxygen for all of the first responder services we work with, not just Winslow, and we do that at no cost to the service. So Delta was formed in 1972 by 3 hospitals located in Waterville. Initially to provide transportation services to the hospitals and also to meet the surrounding community's need for emergency ambulance service. And in that time, there was about 9 communities that Delta served. Our mission is compassion, leadership, and excellence. Delta is a nonprofit corporation. We are governed by a board of directors. It's consisting of representatives from Maine General, Northern Light Inland Hospital, and the community. And it's a 13-member board. We currently employ 130 highly skilled EMS professionals and support staff. And Delta supplies emergency paramedic ambulance to 17 communities, including Winslow. As a full-service ambulance, we also provide routine and critical care transfers from Maine General Medical Center to both of their campuses in Augusta and Waterville, as well as Northern Light Inland Hospital. Additionally, we provide community education, CPR classes, continuing education, what we refer to as the alphabet soup classes of EMS, advanced cardiac life support, pre-hospital trauma life support. We have a Citizens Academy, and we're a well-respected preceptor site for the community college's EMS courses, both EMT and paramedic. So an important element of a successful ambulance is the quality improvement program. Delta's quality improvement program is highly regarded as one of the most robust in the state of Maine. Every EMS service is required to have a quality program as part of their EMS license. So a key component of that program is an engaged medical director. Our medical director, Dr. Steve Diaz, is well respected throughout the state. He's the chief medical officer at Maine General, former ER doc here in Waterville, actively engaged in our process, not only with the team meetings that we have, but also meeting with providers on a one-on-one basis. He's a former paramedic, and he's active at the national level, serving on the National EMS Advisory Council. So our most recent QI study is from 2017. We haven't wrapped up 2018 numbers yet. For the 2017 study, there was a 100% review of all 19,000 calls for service. Our overall compliance rate with our markers was 96.64%. There's no reason to think 2018 is going to be any different. Our program surveys a total of 8 clinical markers, and we're currently moving towards the ultimate goal and working with the hospitals of identifying the patient outcomes based on the care we provide in the street, so that we know that the care we provide makes a difference going forward. A couple of examples of things we look at: 12 lead EKGs. Our paramedics must obtain within 10 minutes of patient contact that 12 lead. They have to interpret it correctly. They have to leave the scene within 18 minutes if it's a cardiac call. They perform their care on the way. When they're done, they write up their patient care report, the QI form, and our compliance rate on that is 97.94%. Identifying strokes is another marker we look at. Our compliance is 92.13% in identifying a stroke. We work with the hospitals. We've developed a program called Code Stroke. We call that in when we suspect a stroke. we take the patient right to the CT scan. They bypass the ER, they get their CT scan, that determines the type of stroke they're having. It saves time to get the clot-busting medications that could reverse that stroke in a lot less time than the previous way we used to do it. And then in terms of cardiac arrests, our survivability rate is well above the national average. In 2017, we had 12 neurologically intact patients go home from the hospital. 2 of those patients were from Winslow. Medicare is moving towards reimbursement based upon quality. They haven't identified their markers yet, but as you can see, we're well prepared when they do identify them. We have a robust system in place and we're prepared for that. And I would encourage you to ask for your department's quality report. So at the last meeting, it was proposed that Winslow should begin its own ambulance service. This would have a major impact on residents and businesses of the community. And without a doubt, it will increase taxes and not generate a revenue to lower taxes. A couple of scenarios you need to think about, they certainly will happen, is a Winslow fire is at a fire, all hands on deck, and there's a medical call across town. Who's going to respond to that call? Or Winslow responds to a medical call and needs to transport the patient to Augusta, which is pretty frequent these days. That's where Maine General's inpatient beds are, and we're diverted there quite often. So who responds to the second call, or what happens when a fire call comes in? Again, our mission is compassion, leadership, and excellence. That's derived from a long-standing dedication to providing exceptional patient care with highly trained and educated personnel who are continually seeking to improve their methods and understanding of emergency medical care. Our staff is supported by a leadership team and board of directors who understand the challenges of an ever-changing healthcare environment. Yes, we have an infrastructure. We have a reimbursement director. We do our own billing. We have an education director, a quality manager, privacy and a compliance officer, an HR department. Our billing department just successfully passed a Medicare audit. No easy feat with 100% success. The software vendor that we use for our billing software gave our billing department a score of 97 on a scorecard of 100. We're very good at what we do, and we've been doing it for a long time. So the question is, who will the experts be that oversee and set policy for Winslow Fire and Ambulance? So how is an EMT different than a paramedic? It was talked about starting just an EMT service. Well, the biggest difference is that EMT's training and scope of practice is significantly different than a paramedic. Although in today's world, an EMT has considerably more tools to work with than even just a few years ago. But an EMT's training is 120 to 150 hours. Paramedics anywhere from 1,200 to 1,800 hours. Paramedics are trained with a wider range of skills to save your life. This is critical in rural areas like Winslow when the hospital isn't as close as it is in an urban area. And so another way to think of it is, and there are many situations where a paramedic has the training and knowledge and the skills to intercede before the patient becomes critical. So you want a paramedic with experience, and our paramedics have experience. You don't want a paramedic that only has a couple of calls a week under their belt. So a few things that paramedics can do: give medications to control internal and external bleeding, advanced airway controls, including a surgical airway called a cricothyrotomy, chest decompressions, manual defibrillation, not just an automatic defibrillator. We can cardiovert, we can cardiac pace. Again, and EKGs and interpretation. And we can administer pain control. EMTs can't give any medication, but paramedics do carry controlled substances for pain control. And again, all of our ambulances that are in a 911 setting have a paramedic on board. They also have the very finest and life-saving equipment available. All of that equipment is top of the line. It's put through preventative maintenance programs. It's calibrated on a regular basis. It's well cared for. So, some of the challenges to starting an ambulance. Starting from scratch is going to be a dramatic difference in the quality and care and availability of service. You need to increase your workforce, hence the purpose of the workshop to talk about staffing. It's going to put pressure on the town to find more EMTs and paramedics. And there already are barriers in place for those people wishing to complete training. For example, in Maine, an EMT class is about $1,000. A paramedic class, $10,000. A paramedic takes 3 to 4 college semesters to complete. So when you think about that, that's just the cost of the class. That doesn't pay for the person to attend if you're paying their wages. It doesn't pay for the person who's backfilling for that person while they're in school. And it doesn't include any of the cost of continuing education, because each level of EMS has increasing levels of continuing education. Finding and retaining qualified professionals will be a major burden for the town. I need to be transparent and share the challenge of finding qualified paramedics. We have 50 paramedics on staff. We have full-time openings. The state is not producing new paramedics. People who are going to paramedic school are already employed. They're working for a fire department or a private service, and they're advancing their license, but we're not generating new medics, and if we do, they go out of state. To that end, at Delta, we are creating our own training academy. So essentially, we're going to grow our own EMTs and paramedics. The medical business is complex and extremely detail-oriented. I'm sure many of you have had experience with processing medical claims or trying to file a medical claim. Medical billing is complicated. Each insurance company requires a different process. I think based on the last meeting, it appeared that the town would contract with a billing company. And that seems simple enough and really, should be a one and done kind of situation, but it's not. A billing company works from the information you give it. They'll bill the call and they'll rebill the call as many times as you want them to. That doesn't guarantee payment. Things you need to think about is who's going to do the follow-up on that bill? Who's going to correct the claim? Who's going to gather the additional documents and then reprocess the claim? Is that all included in the first upfront fee that the billing company will charge you? And then you have co-payments. You have to collect the co-payments. What's going to be the policy on uncollected bills? And there'll be plenty of uncollected bills. You need to know your payer mix for the town. That's crucial to what kind of revenue that you might generate. So in a payer mix is the Medicare, the Medicaid, and the private insurance percentage of the patients that you're going to transport. They all pay differently. Medicare and Medicaid pay on a fixed fee schedule. And then there are audits and takebacks and refunds that have to be issued. Who's going to do all that for you? You'll probably have to contract with a collections company. You may have to increase the amount of general liability and medical liability insurance because some private insurances may not accept the tort claims limit that the state offers. Cyber insurance, because whether or not you're billing or you're hiring someone to bill for you, now you're in the billing business and you have to protect for a potential breach. Mitigating a breach can be tens of thousands of dollars. You'll need a Medicare compliance program. Part of that includes performing audits on your billing company to make sure that they're billing correctly, that they're not upcharging or downcharging inappropriately. And lastly, every person involved in patient care, patient transport, and billing, you have to check to make sure they're not on the Medicare exclusion list. So again, Delta's licensed at the paramedic level. That means there's a paramedic on every 911 call. And yes, we are a business, but we're a business that's grown to meet the demand and expectations of our communities, both residential and healthcare. That team of highly skilled EMS professionals, many of whom are here tonight, that's the most valuable part of what we provide to your community. Starting an ambulance from scratch is definitely going to be a challenge to find the same level of highly trained professionals that will equal the level of service you're currently getting today that doesn't cost the taxpayers anything. So how does the system work today? Well, it's a two-tiered response. It has been for as long as I've been with the company. That's 34 years. Yeah, 34 years. It's not unique to us. It's common throughout the state. It's common throughout the nation. But essentially, the 911 call goes to Somerset. It's then given to Waterville Communications. Waterville simultaneously dispatches both Winslow and Delta, and we respond to the scene. Based on the location, the average response time for both Winslow and Delta is around 7 minutes. We work as a team when we're there. When Winslow arrives first, they initiate care and begin providing care to the patient. When Delta arrives, the paramedic performs an advanced level assessment, any advanced level procedures that need to be done, and then we transport. And when we transport, that leaves your fire personnel in town and ready for the next call to duty. They're not transporting the patient. If you were to transport, the travel time to a Waterville or Augusta hospital is going to pose a challenge. It's a 90-minute turnaround to go to Augusta. Even though it's only 18 miles away, it's a 90-minute turnaround by the time you get down there, drop off your patient, give report, clean, and get back to town. There's increasing pressure to stay at the ER until the patient care report is completed. That could take 40, 45 minutes to an hour, depending on the call. And that will pose a challenge for every ambulance service, not just ones that want to start, but those of us that are currently providing that service. But that'll even mean an increasing time away from town, even if you're in Waterville. You can also face the risk of being asked to continue on to a higher acuity hospital. Something we're seeing now is when you come in, depending on the patient you have, they may tell you to leave the patient on the stretcher, and they're sending you to Portland or Bangor. So again, it's not a quick turnaround. So is it really worth the investment starting an ambulance service when it's going to cost you more than the revenue you generate, and there's no guarantee that your staff is going to be in town when you need them? So response times. That was a pretty significant topic at the last meeting. And I think the information I have you'll find interesting. So on average, during the past 4 years, Delta has received 980 requests for service per year from the Winslow area. It's fluctuated a little from 935 to 1,025, but on average 980. That doesn't mean that's a billable call, that's just a request for service. Many calls are not transported, canceled en route, patient doesn't want to go. So over those same 4 years, we've averaged about 700 transports per year. In terms of growth, that's less than a 2% growth per year. You can't base your budget on national aging statistics. It just doesn't work that way. And I can see people thinking about, okay, 700 calls, if we charge this much, how much is that going to generate for the town? Again, medical billing doesn't work that way. You can charge whatever you want. The insurance companies will pay you what they pay you. And Medicare and Medicaid are fixed fee schedules. Medicare only pays 80% of what they allow for a rate. You have to collect the other 20%. Main care, or Medicaid, pays 65% of what Medicare pays. It's not much money. The third-party insurances, the Blue Crosses, the Aetnas, United Healthcares, you need to negotiate a contract with them. Otherwise, if you don't negotiate the contract, they'll send the money to the patient. And the patient will decide whether they pay the medical bill or if they put food on their table. So in the Journal of American Medical Association, October 2017, there was an article titled Emergency Medical Services, Response Times in Rural, Suburban, and Urban Areas. And I quote from the article, emergency medical units average 7 minutes from the time of the call to arrival on scene. This is a study of 1.7 million ambulance calls. The median increases to more than 14 minutes in rural settings, with nearly 1 out of 10 encounters waiting for almost a half an hour for the arrival of the EMS unit. 71% of calls result in transports. And if you talk about the 90th percentile, which is where the evidence is leading us, a suburban response time is 14 minutes, urban 12 minutes, rural 26 minutes. And again, that's 1.7 million calls that they took that information from. So what are Delta's numbers? We're on scene in 12 minutes, 89% of the time. Less than 12 minutes. 12 minutes or less. In 14 minutes or less, we're on scene 94% of the time. There's always going to be outliers. Even if it's a town-based service, there are going to be outliers. And those outliers are unforeseen circumstances like weather, traffic, a school bus, a bad address. I mean, it happens. a second call. So in summary, I think Delta Ambulance is the best choice for providing high-quality, compassionate emergency services with state-of-the-art technologies to the town of Winslow. There's a lot more that we do, and I look forward to working with the council as you discuss this critical topic. But I think today, the most important thing that people in Winslow should take comfort in is that the quality of care they receive and the dependability of Delta. When our paramedic ambulance arrives, to help you know that our only concern and our only focus is providing the very best medical care to you or your loved one. And I'd invite the town council and members of the community to look at our website, deltaambulance.org. There's a lot more information about Delta there. I'd also encourage you to come see our Waterville facility. Happy to give a tour, both either to the council or members of the community. I know many of these guys have been there. You can do that by calling Crystal Tavares, 861-4228, and I have some literature that has that number that I'll leave with you before I go tonight. So, thank you.
Thank you. Appreciate that. Should we hold questions until the end of the question vote probably? Does everybody agree with that? You like that idea? Okay. You're up then, Chief.
Well, I appreciate the opportunity, but before I get going, I gotta pump my people up a little bit here. It started September 17th. One of the first things I did was to assess the department. And one of those things was to ask the members of the department, what do you see as our greatest need? Without hesitation, each one of them said, we need a new boat. I said, a boat? I said, yep, we need a boat. Today we got our boat, and it cost the town nothing. We put in for and received a Firehouse Subs grant for the amount of $27,339.61. That's one of 5 grants that we've received since I've been here. We've received over $54,164.61 in grants. $2,500 for protective vests, $825 from a grant to provide EMS equipment. I know that's not much, but it's a start. The one I'm most proud of is we're sharing in a grant with our neighboring sister town of Waterville, where 7 of our members are going to be attending an advanced EMT class at a cost of $100 per student. We also received $9,500 for a gear extractor. We have the hardest working people in this department. And I just want to let you guys know that we don't come to you without coming to you with solutions. We have ideas, and we are bringing forth solutions. I appreciate, Tim's report. It is no doubt Delta has been in business for a long time. I have also been in the business for over 26 years in a fire-based EMS system where the fire department provides the ambulance transportation, 26 years. I understand about transport to hospitals. I understand about reports. He brought up some significant questions, all of which can be handled. Regarding your EMS billing, I'll hire them. You know, they've already got the infrastructure. Why recreate the wheel? I am not in competition with Delta. That is not my goal. My goal is to increase our staffing with minimal impact to the citizens of Winslow. Before you, I have provided 2 documents, 2 spreadsheets, if you will. One lists towns of the size 5,000 to 10,000 residents. The check marks next to those towns indicate those towns that either have a fire service that provides ambulance transportation or the town itself provides the ambulance transportation. Over 50% of the towns between the size of 5,000 and 10,000 do their own transports. Our neighboring town, Clinton, provides their own transport service, and we've relied on them on several occasions. A more comprehensive list is a spreadsheet that I gave you that has the highlighted, well, my copy, yellow, yep. The lighter highlights are the towns, the fire departments that provide ambulance service. The darker highlights are the municipalities that provide the ambulance service. If you listen to the naysayers, there's two groups of naysayers to this ambulance transporting service. One are the macho fire departments that say, we ain't gonna do that, we're firemen. Okay? They want no parts of it. They're the dinosaurs, and they're gonna be going out of business very soon, because if you don't stick around and if you don't change, then you're gonna die, just like the dinosaur. The other naysayers, the other group of naysayers, if you look deep and long enough, you will see that they have a vested interest in the success of a private ambulance service. I'm not saying that the private ambulance services don't have a place in our community. What I am saying is if you would read the pre-hospital 911 emergency response white paper that was put out by the IAFF, you will see that the fire-based emergency medical service systems are strategically positioned to deliver time-critical response and effective patient care. Their primary purpose is to underscore the reality today that fire services become the first-line medical responder for critical illness and injury in virtually every community in America. It has become almost universally a principal duty of the fire service as well. Although the role of the fire service is central to 911 emergency medical response, financial, political, cultural, and organizational factors often can make the conversation about pre-hospital care providers confusing and complex for many decision makers in local communities. Fire service equipment personnel to provide 911 emergency response is the best approach for community regardless of size. Fact-based right here. Of the 200 largest cities in the United States, 97% have fire-based pre-hospital 911 emergency medical response, and the fire service provides advanced life support response and care in 90% of the 30 most populated U.S. jurisdictions. So we're not the biggest city. It's an economy of scale. It's basically the same process at our level. We can do this as demonstrated by the fact sheets that I've given you with the fire departments and jurisdictions that do it right now. We're talking about, and Mr. Beals did bring this up, adaptation. The fire service isn't the same today as it was 34 years ago, 40 years ago, 10 years ago. It's changed. And the fire service has grown and adapted to the change to meet the needs of the community. We have an age-old firefighter mantra to protect and save lives and property. Pre-hospital 911 care began in 1964. Dr. Eugene Nagel. He chose firefighters from the Miami Fire and Rescue. We chose firefighters, I'm quoting Dr. Nagel, we chose firefighters because they were there. They were available, and they were willing, and they were motivated. It was really quite simple. The fire service is dispersed throughout America and is everywhere in our country. It is an efficient method for offering emergency care rather than creating a completely separate service with separate communication, vehicles, housing, and personnel. It has worked well in Miami in the 1960s and continues to work well when integrated into the fire service. It is a natural fit. Today, the community-based fire station, with its ready availability of personnel 24 hours a day, coupled with the unique nature of medicine outside of the hospital, creates a symbiotic blend of the traditional public concepts and duties of the fire service with the potential for the most rapid delivery of advanced pre-hospital 911 emergency response and care. Traditionally, fire stations are strategically placed across the geographic regions, typically commensurate with population density and workloads. This creates an all-hazard response infrastructure. Firefighters just aren't firefighters anymore. We are trained higher, our education requirements are higher, and we have adapted and grown with the training requirements. I submit that we can adapt and grow with an ambulance service, providing pre-hospital care to our citizens. While there are pros and cons to the various system approaches, the emergency medicine literature indicates that the most likely time to create error in medical care is when care is transferred from one provider to another in a relatively short encounter time. The quality assurance is most effective when the fire department, as the public agency, administers and monitors the performance requirements on scene and within the transportation agreement. The fire service is the creator of the unified command concept that brings everyone to the table at the same time. Using the National Incident Management System, the fire service has superior ability to coordinate incidents of any size. As a result, it provides the best return on investment of public dollars to provide the delivery of pre-hospital 911 emergency medical service. Such services are typically not performed by the fire department as fundamental public policy device to better ensure dedicated 911 emergency services and thus provide security and prosperity for the community served. The mission of the fire service is to protect and save lives and property. There are no other conflicting agendas. Our number one priority is to save lives. That's the bottom line. Again, fire service is to become hazmat teams in front line of protection and rapid delivery of medical care and medical care can be preempted by such chem bio threats, but where rapid care can be given, it can be expedited directly by cross-trained fire service hazmat care providers. This report was brought about as a result of the 911 happenings and the need for fire departments to adapt to increased personnel. Above all, rapid response times are a pivotal advantage of the fire-based service, pre-hospital 911 emergency EMS systems. Rapid response times. Time efficiency is a key component of the best designed EMS systems. The service most capable of rapid, multifaceted response, rapid identification, and triage to the appropriate facility is a fire-based EMS system. The best part of all, fire departments have the advantage of having a freestanding army ready to respond anytime, anywhere. Fire-based EMS systems are strategically, positioned to deliver time-critical response and effective patient care and scene safety. Fire service-based EMS accomplishes this while emphasizing responder and patient safety, providing competent and compassionate workers, and delivering cost-effective operations. So we have something going on here. I'm being told that if I add personnel, I'm not going to be able to provide service to my community. My plan absolutely brings service to the community and puts our community first. I find it interesting. I want to keep this Delta Ambulance Service does provide, Mr. Beals made a great point, when they get there, they provide excellent care. That is without a doubt, when they get there. we might have had a different story 2 weeks ago when that school bus wrecked and we had over 20 patients, and it was 17 minutes for the second ambulance to get there. The issue, admittedly, by Mr. Beals, is that there's a staffing issue. I cannot concern myself with Delta's staffing problem. I do know on a daily basis there are multiple pages to fill seats for ambulances to roll every day. At times, they pull their office personnel to fill those spots. I am not concerned with their problems. I would like to work with them. I would like to see our ambulance service work to supplement their services. My concern is the citizens and residents of Winslow. The bottom line is, what is a life worth? I can bring in the revenue stats from any town that puts it out on their website, but based on the sheets that I've given you, obviously this is not new. It's not new to me. There is, if you will permit me, I did a little digging, and I came up with some figures. And I say this not to brag, but to be comparative purposes only. I came from Fairfax County Fire and Rescue Department. Fairfax County runs 75,123 EMS calls a year. From that, they generate $21 million. All right? If you don't have insurance or you can't afford it, they don't bill you. That's an average of $280 a call. Fairfax County, I'm not bragging, I'm just making a point, is the richest county in the nation. It battles between Montgomery County between number 1 and number 2. Delta Ambulance Service generated $7.3 million last year. Based on Mr. Beal's admission of 17,500 calls, that's $417 a call. So per capita, they're making more than Fairfax County. I can't sit here and have the presentation before you that this is not a revenue enhancing program, because it is. I would just be copying the model that they put forth. I understand there's a lot of ins and outs. That's why we hire people to do the things that they do. The bottom line is, I am not out to compete with Delta. I am out to provide the citizens of Winslow timely transportation to the hospital for definitive care. If you see my proposal all the way through, within 3 years, 2 years actually, we would have 2 ambulances, a new one and the used one that I want to purchase to start with. The used one becomes reserve. We rely on our call force to utilize that to get the second EMS call if there is one. There is a plan that I have in place to make this system work. It's not new to me. I've been doing this over 26 years. 26 years I've been doing this. It's not as long as Mr. Beals has been doing it, but it does work. If it didn't work, they wouldn't be in the business. I take exception to the fact that on the one hand, we are told that we don't have quality personnel providing emergency medical care. We do. Outstanding. Delta has outstanding personnel working for them. I have not disparaged them in any way, shape, or form. That has not been my intent. I am merely pointing out the fact that the number of times they've been delayed. That's delay getting to the scene. Once you get to the scene, you do have a turnaround time before you're en route. Most of the time, by that time patient care has been transferred, we could have already been on the road halfway to the hospital. So, who's right? I am. Because if I wasn't, he wouldn't be here fighting to keep us from getting an ambulance. Thank you.
Where do you guys want to begin?
Well, I would like to look at the numbers. You know, I've heard the words, I want to look at the numbers. You know, if I could, Chief, I had written up some questions.
Yes, sir.
And I just want to make sure that I interpret the spreadsheets right, and there were two options that were looked at. One was to start out with a used ambulance, and then that was spread out over a period of years, showing revenue, so forth, so on. And at least my reading of that, if I'm, hopefully I've got it somewhere there right, is we lose money for the first, well, it will be into year 4 before we break even, revenue and expense. Is that correct?
Based on the estimates that I have, yes.
Okay, so the first 4 years, we're actually in the red. Is that correct?
If we buy a new ambulance.
Well, no. Well, actually, this was starting out with a used ambulance.
Correct.
Then buying an ambulance year 2.
Correct. If we don't buy the new ambulance, this is the thing about that spreadsheet that I've given you, is that we can tweak it however we want to go. And I specifically started with the used ambulance because it's more cost effective. The risk to the town is less if we start off, because you know, equipment is expensive. You can spend $250,000, $260,000 for an ambulance. And might I add, I was given a copy of Mr. Beal's response, and where it was insinuated that I cited Albion, the town of Albion, as being a success. I was merely trying to point out that the ambulance transport was so important to the town of Albion that for their minimal calls, less than 100 calls a year, around 50 calls a year, they spent $250,000. Yeah. With no revenue. That is, to me, that speaks volumes. That is a significant investment. And if you look at what I'm trying to do here, we have, if we were to replace all the suppression pieces of equipment out there, it costs us over $3 million. Okay, for engine, right, ladder truck, tanker. We have nothing for the 75 to 80% of the calls that we run, other than, you know, the basic equipment on our rescue.
Okay, again, I'm just going back to the numbers.
I understand, but what I'm trying to say is that there are variables that we can manipulate any way you want in there.
You know, I just want to make sure that it's realistic.
What is
realistic numbers?
I think it's realistic. If you look at what Clinton is doing, it is almost identical.
One of the other assumptions that we have to make is some estimate of transports as well as the revenue per transport. What I notice is that it appears that in year 2, the revenue is $380,000, which works out to be something like, what was it, 900 transports a year?
Yeah, I based it on around $400 a transport.
But I just heard that the Delta experience has been, make sure I get it right, the last 4-year average for Winslow was 980 call-outs and 700 transports. So where are we gonna pick up the 250 more transports?
That was an estimation.
Okay,
And that whole spreadsheet was based on estimates. I have no doubt that we will pick up additional calls. Now, I gotta be careful, because the primary purpose of the ambulance is to serve the citizens of Winslow. We can put off purchasing a new ambulance however long you want. But I think the prudent way would be to start with a used ambulance. I have no doubt that that Delta has trouble retaining people. He's already admitted to me that he loses them to the fire departments. He's already said that. What we offer as an enticement to bring paramedics to our department, we have a retirement. A lot of people that are working for them are working per diem. People want to have security of a full-time job, and that's what I would be offering them.
going back to the spreadsheet, just to make sure that I understand it. In year 2, the assumption, which appears to be valid, is that the average revenue per call would be $400. And
Sure.
that seems to be in the realm of possibilities. If we're only transporting at the 4-year average of 700, that would bring our revenue to 280,000, which is $100,000 less than what we're showing here. So rather than actually being in the blue by $1,000 year 2, if that is correct, we could be still in the red by $100,000 if we're only transporting at 700 per year with 400 average revenue. Is that correct?
That is correct.
Okay. The other thing, and I appreciate the work on this because it really helped me understand it. How many of our current EMTs are paramedics?
I have one on my call force that's paramedic, but as I said, we would be, 7 of us are starting next Tuesday with the advanced EMT class. Now that's a level below paramedic, but at, no offense, but at the rate we're going, by the time we get this thing rolling, we'll be done with the class, and we'll be able to at least run advanced.
So, in principle, what we're going to have to do is train 6 to 7 people.
No.
No?
No, we don't have to train them.
Up to paramedic level?
No, we can. I would more than welcome it, but we don't have to train them. We can go hire them. And this is what I'm trying to get you to understand. The bulk of his staff is per diem. They get no benefits. They have no benefits. That's what's attractive about municipalities, and that's why fire-based EMS systems work. Because we can attract the personnel.
So we would hire them more than likely from Delta.
Actually, we have very few per diem
from that pool out there of people who are already trained.
Correct.
At the paramedic level.
Correct.
Because isn't it correct that if we go to ALS level, that we've got to have a paramedic on that truck?
No, sir.
Huh.
It is all based on what you permit to. What you license to versus what you permit to. You can license at the basic level,
okay,
but permit up to paramedic. They license at the paramedic level. Therefore, they have to have a paramedic on their units. We can license at the basic level with the permit up to paramedic, which means if we have a paramedic working, we can perform the paramedic functions.
So we could end up with an ambulance without a paramedic who is limited into what services they can provide.
Theoretically.
That my layman's understanding.
Theoretically, you're correct.
We could just end up with 2 EMTs who can only do certain things.
Well, we're going to be above EMT level in 6 months.
Okay.
we're gonna be above the EMT level in 6 months. And I do have one paramedic on the call force.
Okay. Thank you.
What is Clinton licensed at? Clinton ambulance, are they licensed at the basic level or the permanent
Yes, they're
level?
doing exactly what we're doing,
We're doing at the basic level.
permitted up to paramedic.
So at what point in time, and we're gonna license at the basic level, so when you get to advanced level, in whatever time, then depending on the purchase of the ambulance and what's your estimate? I think it's 2 years before we start transporting, or when would we start transporting patients?
Year one.
Year one, right?
Correct.
Yeah.
But some of those transports may not have a paramedic on board, is that,
If we license at the basic level, I wanna say, and he can back me up on this, of the 700 some odd calls, I would imagine about half of them are BLS, basic. We could transport those right now. But we're not gonna get that kind of, we're not gonna get the transport billing commensurate with an advanced life support transport, which is why I estimated low. We can take as long as we want to implement a second ambulance. That was one way, that is the roadmap that I'm using for us to get to having 2 units. We can take longer.
so if you have, just one second, if you have the one ambulance, does that mean you would rely upon a system similar to what we do now with the fire control mutual aid type of a setup where
Sure, yes.
the second call comes in
Yes.
and someone else
Right.
handles that second one
Right.
until we gear up to the
We
second?
fall back to what we're doing right
Even
now.
if we have 2, it's possible we would need 3 on
That's exactly
some,
right.
and you
If
would
that-
still have to rely
That's
on it.
exactly right. If that bus accident had 17 patients that had to get transported, we'd have to get the help from someplace.
Yeah. Go ahead.
Say we had a call, we've got a basic license, but we don't have a paramedic on board, we get to the call. At that point in time, we would not automatically send Delta out. At that point in time, if we're transporting, we get out there. If the call, say it's out on the China Road someplace, if the call determines that an advanced level of care is being needed, at that point in time, what would be the procedure that we would go through for that advanced care?
We could request a paramedic intercept.
Protocol requires that. You'd have to request, state protocol requires that basic or advanced services in certain situations have to call for an ALS or paramedic intercept. So,
I think for me, and I'm unfamiliar with the advanced EMT, what they can do anymore, a basic EMT, advanced EMT, and then a paramedic. I guess at some point in time, we will have to spell out those differences. We might have had them before, but I'm unfamiliar with them right now, so I don't know what an advanced EMT
I got it right
can do
here if you need it.
versus a paramedic.
Just a quick question, if I could. Do every time you send out an ambulance, does everyone have a paramedic on it?
every 911 call,
Every time there's a call, there is a paramedic?
there is a paramedic, yes.
One of the 2 or whatever?
That's because that's because Delta's licensed as a
So he
paramedic.
has to have.
He has to have that.
Okay.
And the reason that you need the and this is my layman's understanding, the EMT is external and really don't administer medication or do.
They can administer, they can do Narcan, they can administer epi for an anaphylactic reaction, sure.
Whereas the paramedic,
Has a whole pharmacy.
the whole pharmacy can actually puncture the body or whatever is a very technical term. So that's why it's so important to have that paramedic, depending on the situation.
In a rural setting, to get that paramedic there first saves you time than
Because-
having to wait for an intercept.
Because he or she on the way to the hospital can be working with the emergency room, actually doing some procedural stuff that shortens that gap.
Mike, the chief just gave me this, it's just the different levels. Could you make a copy and PDF file and just send it to each one of us? So that we'll have all that information.
Does anybody else want to ask a question here?
Yeah, how many lives have been lost due to the fact of not transporting by transferring by the fire department. You know, because you brought that up, you know, as far as being able to transport with our fire department. Instead of using Delta as we do now, is there a figure? You gave us a figure on how long, 7 minutes, I think.
7.8 minutes
Yeah.
is our average response.
Which is an average.
Which is an average,
Oh, yeah,
but when you look at the 90th percentile, 12 minutes or less.
but that's
99.
7 minutes to have a paramedic
Absolutely,
at site.
that's like,
Well, 7.8 is 8 minutes.
so yours is 7.82, but I'm just guessing. It's a rural setting. You're not gonna meet the NFPA standard in a rural setting.
No.
You're just not. You're not gonna get somewhere in 4 minutes in the town of Winslow.
We do.
On occasion, we do too.
I agree. But what I'm trying to do, and I really don't want to get into this, he said, she said, contesting here, but the bottom line is, this is a nationally proven methodology. It works. It is going on right now in rural Maine. It is going on right now in rural Maine. This you cannot dispute.
What's the estimate of lives saved if we go to the fire department instead of using Delta? You know, it's kind of
I
getting
don't know if you can do that.
pie in the sky.
That's not a fair question.
No, I know.
But I can tell you, you would think that if I stood up there and listed the stats and the response times like I did, you would think that the very next minute they would improve. And they haven't. And that's because there is a staffing problem at Delta. The questions that are posed of me, what are you going to do if your transport unit is in Augusta? The same thing they're doing right now. When their transport units are in Augusta, we're going to beat feet back here. All right? 90-minute turnaround time at the hospital. Goodness gracious.
Now, you brought up, you know, the one ambulance, 2 ambulances. If you have 1 ambulance, how many additional personnel do we have to have on site to run that 1 ambulance? And if you had 2 ambulances, how many personnel do you have to have on site to run those 2?
Well, we could run.
Not all of your firemen are going to be running.
Why not? They do it right now. Every EMS call they run right now, we run it.
But according to this, we have no advanced EMTs, just EMTs.
Well, I don't like that word just, but yeah, we have EMTs.
Yeah, okay. But what, you know what I'm saying?
And I have on my call force. I know it doesn't sound like much. You know, this is little old Winslow. We have 1 paramedic, but we have 1. And I don't have an ambulance yet. That's the operative word. Yet. I don't have an ambulance yet. But I've got 7 personnel that are willing and going next week to get the advanced EMT certification. So the point that I'm trying to make in this is that I've got buy-in from my department to the point that they're going to get the additional education and training to meet the needs of the citizens of this town. And it's not costing $100 a person.
If those 7 wanted to take the next level and advance to a paramedic, or say half of them wanted to, 4 of them wanted to, what would that entail? How many hours? How much money per person? Would you encourage that, or would you hire paramedics already trained? Or
the objective for me is to hire, because I want to get this thing rolling, is to hire paramedics right away. I'm not going to discourage anybody from getting an education and bettering themselves. Absolutely not.
But that would take longer than just hiring
Absolutely, it's going to take a lot longer.
Yeah. And it would cost us to do the training? In theory?
In theory.
Yeah, if one of your personnel
Yep.
wanted to take that training, we would
Yep.
pay for it.
And I would encourage that.
Raymond?
I'm probably gonna say something that's not correct, and probably make.
I said a few things.
You wouldn't be the first one.
It's all good.
That's what a workshop is.
This is new to me right
This is
here.
a workshop, and
Yeah.
we don't have all the answers, and sometimes we just say things that we just have to say because we don't know any better.
That's right. I think they say things all
But, you know,
the
what
time.
I'm thinking here is saying, for the citizens of the town of Winslow, is saying that, well, if the 7 of our firefighters want to take the advanced EMT course, to me, that would be great, because when they go out on the initial response to the call, they can do more, and they can get a level of care that's more than we have right now.
Right.
Given the staffing problems with Delta and everything, I would say that, Mr. Beals, you must be working on that problem, and I know you are. I know it's a concern of yours, and I'm sure you're trying to find levels that some type of solution.
Yeah, we have openings. I mean, we just hired a paramedic today. We have lost paramedics to fire departments, but I will tell you, they're not going to small departments. They're going to the bigger departments, Augusta, Portland, South Portland, Scarborough, Saco. They're not going to small departments. I think if you were to ask your colleagues in Clinton how their staffing works and the turnover that they've had, you'll find that they lose paramedics on a regular basis because they're not busy, and paramedics want to be busy. And so Clinton has they just lost a paramedic to Augusta Fire, so they're back to looking for a paramedic.
Look, to me, I think whatever we decide here, it would seem prudent for us to have our EMTs up to the advanced EMTs to be able to provide more care for our citizens, you know, no matter what we decide. What is the basic difference between like an EMT, just basically, and what an advanced EMT can do? I mean, I know that's probably an unfair question because it's 4 or 5 page document.
It's not, there's not a huge difference. 12 leads, they can initiate a 12 lead.
At the advanced?
But they're not trained to read it. They can take the 12 lead and bring it with them. Some advanced airway procedures, a few meds. But that's it. I mean, an EMT, like I said, an EMT today compared to when you're an EMT is a night and day difference. What an EMT can do today. An advanced is certainly better. We work with first responder services amongst the towns that are permitted to paramedic. When they have a paramedic in town and a paramedic first response, or an advanced level. It's all in the permitting process, as the chief mentioned. You can start at one level and then permit up depending on who you might have available on a given day. It doesn't mean you're going to have that person every time.
So Chief, the initial, what we would do is for the hiring more people here, we would hire paramedics, or we would hire like EMTs and train them up to the paramedic level. Would we try to get paramedics into the system?
I would try and get paramedics into the system.
And those paramedics would also respond to the fires? Would
Yep.
also be trained for
Yep.
fire? for
Cross-trained, yes.
Cross-trained.
Firefighter paramedics. That's 26 years, the way we've done it. But I am not there anymore. We can do it here.
Didn't you mention there's, what, $10,000
For a paramedic,
to train a paramedic, that's per person?
in 3 to 4 semesters. But if they've already at the advanced level, that time frame shortens a little bit. That's 3 to 4 from ground zero to paramedic.
And you lose them for, you know, your firefighting capabilities and ambulance service and everything while they're doing the training?
No, not necessarily.
They can work around it.
Especially if they're advanced, I would assume.
Right, no, I understand what you're saying is that if they go for their paramedic license, then they're out of service.
Yeah.
No more than we're going to be out of service going for the advanced EMT.
Raymond?
You know, I've gone down to the fire department a number of times and talked to some of the firefighters, and, you know, they're very enthused, the ones that I talked to anyway, about being able to move up to the level and be able to provide more services to the citizens of the town of Winslow, but if there's any one of them that would like to at least say something, you know, of the regular, I know there's a lot of the, the regular people that are regular full-timers here today, is that if they would like to say something, then I think that would be a prudent part of this workshop. I hate to put them on the spot, because it really wasn't planned, but you know what I mean?
It's a workshop.
Yeah,
it's a workshop.
I don't know if any of the
more information we
anybody
can
would
gather,
like
the
to come up
better.
and just say a few things.
We're trying to get this part done first.
Yeah, how are you guys on specific questions? Do you have any more before they start?
We're trying to get this.
Just one second.
We can if you want to. I just suggested.
I just wanted to make sure that every councilor
I
had
didn't
asked.
want to make a time frame. I just wanted to give the
You're right,
opportunity.
there will be an opportunity.
One of the things I think is very important, that we deal with realistic numbers and facts.
We have to do that, yes.
We have to do that, because if we're gonna put a business plan together to make this happen, we've somehow gotta get the resources to do it.
Yeah.
What I would suggest is, I think we need to have another look at these spreadsheets and bring the revenue number. Maybe we will get 900 transports, but if history says we only do 700, then I think that revenue change has to be shown. At least as this could be what it would mean.
I can adjust that and email it out without a doubt in a hurry.
Yeah.
My question is, what hard numbers do you want? What numbers do you want me to present to you based on what, you know, you want me to use Howland's numbers? You want me to use Bar Harbor? You want me to use Clinton? You want me to use Gardner? Do you want, there is over 100 fire departments that transport, and it all depends, like Mr. Beal said, it all depends on who's paying. And mind you, my objective is to provide a service to the citizens. It's not so much to collect money. I am not out to raise and run a business. I understand we have to have the data to support.
We have to pay for it one way or the other.
But we've made it, yes, and the point I'm trying to make is we've made an investment in the equipment that we have for the 8% of the calls that we run.
What I think, you know, that the good news is there are a lot of towns, and
That's exactly right.
So I would think that if we could pick 4 or 5, make a contact, see what their budget is, see what their experiences have been, how do they actually do it? And fortunately, there's some that are pretty close.
Who do you want? I got Thompson right here.
Well, any information's fine. I was just thinking of places that are about the same size. And
Thompson,
Cumberland, Old Town.
Cumberland's not gonna be a good, you need a demographic that's the same.
Yeah, that's true. That doesn't, that's just population demographics is the only thing, right?
I have Belfast. Do you want Belfast?
Belfast would be closer.
And really,
but
the
still-
thing I'd like to see is what the budget is. You know, the detailed budget. How many
Winthrop
people-
probably would be a good town.
Yes,
It's a
it
little bit
should be.
smaller, but probably the same type of demographics.
Their reimbursement will be higher because they're classified as super rural,
Okay.
so that won't be accurate. Winslow's not a super rural
I'll
town.
tell you what, why don't you give us a couple names that we should call, and the chief can give us a couple names, try to match demographics and be as
No,
fair
I
as we
think,
can.
I think you should,
Well, I can tell you one thing, this is overwhelming for me at this point in time.
It is overwhelming.
This is above my pay grade,
It's-
and I know, I've never been in an ambulance, and I've never done, you know, like Ray probably has more experience than I did, so I'm gonna rely on his expertise a little more, even though it's been years. But you can know the questions to ask, though. That's what I like, is.
There's a time frame that I.
It's been too far? Okay.
And this, I think this might have gotten somehow lost in translation, is my whole premise starting out was that we are below safe minimum staffing levels. And my objective is to get us closer to safe staffing levels.
So because they're cross-trained, you would be able to bring the staffing levels up to a more reasonable
Absolutely.
level.
Absolutely.
and provide an extra service.
Absolutely. And this offsets the revenue. No matter what we get, it's offsetting the cost to run the ambulance service.
Right, yeah.
Good, Mr. Chairman.
Yes.
Since we brought it up, I think that there are really two questions that we're trying to get at. One of them is the staffing, the current staffing levels. And from my understanding, looking at your report, that is, the issue is primarily caused by unexpected long-term absences.
No, sir.
No?
We are currently way below nationally recognized minimum safe staffing levels.
But when I looked at your report, what seemed to jump out is there are only 6 people full-time anyway, and there is one long-term absence out on medical leave, which in turn I can see that's 1 out of 6 right there. And then in turn, when we look at the financials, the overtime and all of that has been significantly higher.
Correct.
So I think that we need to also talk about what are we going to do, not in the short term, but in the immediate, even if we don't transport, to have the right staff so we haven't got people working overtime as much.
I say that's a main concern.
Right, and now I appreciate looking at the transport as a way of getting additional revenue, but I think that we've also got to make sure that we don't take on more and end up with short staffing.
But I think, correct me if I'm wrong, but I think he's also contending that by taking on the transport, we are increasing the staffing automatically.
Staffing, but that staffing is going to be doing additional work, which they are doing now.
But 75% of the calls are the rescue, 75 or 80% is the rescue, not the fire truck.
But think about what.
Again, I'm trying to understand this too, I'm trying to digest this too.
Rather than just responding.
Right.
We're now going to be doing another piece of work, which is transport.
Responding and then transporting, yeah.
So I think that we have to look at it to say it's not the same amount of work, to make sure that we have the staff enough to do that additional work.
Okay.
And not find ourselves right back into the problem again.
Of still being short-staffed because we've taken on another duty.
But while that one duty is being performed, we're still left with the current staffing level back home.
Right. But we're short right now on that staffing, correct?
What are we looking for on the staffing level? Right now we got 6 full-time. How many more full-time and how many call?
In the long term or in the short term?
Both.
In the long term, I want 4 on a shift.
How many shifts?
3.
And you currently have 2 on a shift?
We have 2.
Times 3.
The reason I want that, because that brings us more in line to the nationally recognized safe staffing level. That when we roll out for that 8% of the time when we're running a house fire, we can go to work right now based on the 2 in, 2 out requirement set forth by the OSHA standard. Now, I realize Maine is not an OSHA state, but we do adopt their standards.
So in theory, correct me if I'm wrong, you want to double the amount of staff full-time.
In the long term. Yep, absolutely. In the long term, yes, sir.
Even if we don't transport.
That's why I want to transport.
Well,
Because it pays for it.
Okay, right. What the transport does, it brings in revenue to offset the added cost of the 2 additional people.
Yes, sir.
Okay. See, I think it's important to get that clearly. Well,
obviously I wasn't.
Well, no.
That's my fault. My wife tells me all the time I don't communicate very well, so.
There is receiving and sending, and this is probably not receiving it.
That's right.
Exactly, that's what I was going to say. Sometimes it's on this end, it's not getting the message too, yes.
And I think that's important for us to get that understanding. Because it's not like we haven't got to do something. We've got to do something.
Correct.
And that if we can figure out how to do that, then one of the options to look at is there an opportunity to then transport, to get an additional revenue stream to mitigate the expense of the additional staff.
Staff, right.
Correct.
Right.
Now the question comes, in what period of time are you looking at this?
That's gonna be up for us to decide.
Yeah.
Could be 5 years.
We're gonna look at you and say, when do you need this?
I need it right now.
Okay,
I was gonna say yesterday, I don't know.
I mean, admittedly, when I brought this up at the last town council, every one of the council members admitted that they've known for a long time that our staffing levels are substandard. So, I mean,
How do we get started? You get 6, right? And how do you get started? You go and bring up 3 additional to make it 3 on a shift? I mean,
Yeah,
that's a lot to jump up.
no, I understand. It's a big chunk. That's why I
6
said,
full-time.
that's exactly right. And and I've had this discussion with Mr. Heavener that the progression would be gradual. I'm not looking to bring on 6 additional people tomorrow. You know, it takes time from the time you say go for me to actually get an ambulance in service. Once we get the ambulance in service, once I get the permission to do this, I can start advertising to hire 3 people, 1 per shift.
I'm not really talking ambulance right now, I'm talking about personnel, for you to go, get to the point, do in, do out. That's the fire, that's what I'm talking about now, not the ambulance service right this minute.
Okay.
How many do you need up front? We're gonna be getting into budget sessions here, another couple months. How many are you gonna need now to get up to where you need to be this spring on personnel?
To bring us up to the safe staffing level, I need 6.
I know that.
I'm trying to answer your question. You said, how many do I need to bring us up to a safe staffing level? Right now, we are 2 below per shift right now. Mm-hmm. When we roll out the door, we get there, it's like having a mechanic's tool chest and no mechanic to work on the car. I can get the equipment to your house that's burning, or I can get the equipment to the house that has the CO levels, or whatever the emergency is. I can get the tools there. What I don't have are the mechanics to operate the wrenches.
Well, what's your cost per person full time?
Round figure,
Yeah,
about 60 grand.
60 grand a year.
So round figure
Yeah.
without overtime.
Firefighter base, to hire a firefighter, right? Just plain EMT firefighter, including benefits, $61,230.27.
So
You're talking, they're doing 300 and some thousand dollars.
360,000, not counting overtime at this point. The staff was
To hire 3 is $180,690.82.
How many for 3?
183,690.82.
I hate for this stuff to come down to dollars and cents, but in reality,
Well, no,
we'll
that's-
deal with that too.
well, yeah.
In reality,
But
we
it's-
have to deal with
yeah,
that
I
too.
mean,
Yeah.
That's
know,
part of it.
If the checks start to bounce, I don't think
Yeah,
they're gonna
exactly.
be very happy.
Yeah.
No.
Yeah.
So we gotta get the revenue one way or the other.
Yes.
Now, the next question comes is, none of that money would be available until July 1.
What money? Are you talking about?
Money
Increase
that
staffing?
increases personnel.
Personnel, right.
If I could part it, and we probably can't get into this level
That's
of weeds here, but looking at what's happening right now because of our sick leave replacement costs, we're about $1,400 a month right now. Our overtime is $4,800 a month right now. So as we bring in more people and get them trained, are we gonna be able to reduce some of this sick leave replacement and overtime costs? Because we must be backfilling for the long-term absence. Not to mention vacations and holidays and all that.
Just from the time period of October 21st to December 26th, the replacement cost for the injured personnel was $10,412.95.
And that's since October.
That's just October to December, yes, 2
Okay.
months.
3 months.
So, as we work through this, and probably not tonight, but as we work through this, I think that we've got to look at that total picture.
Yes.
And look at such things as vacation replacements and everything. As we bring more people in,
Will those go down?
have we an opportunity to reduce some of those costs because there's just more people available?
Well, and that's
That's a question,
That's an
not a
excellent.
statement.
Yep, that's an excellent question. And the issue with that question is, if we're recognizing that we're below minimum, and we bring in personnel to bring us up to a safe staffing level, and then somebody calls out sick, are we then saying it's acceptable for that day to drop below the minimum again?
That's
And
what we're gonna have to address.
Without filling that role.
Correct, and that's something that
That's what we're gonna have to address.
we are gonna have to address that.
Right.
There's one other financial piece that I think I would like to have us explore, and probably it's going to be at the committee level. But you mentioned our ISO rating
Yes, sir.
is now at the lower level, right? With increased staffing, one way or the other, through ambulance or just us doing that, that ISO rating improves, right?
If we get evaluated, right?
Once you get evaluated. At some point in time, that must affect the taxpayers.
It does.
In the town, especially business owners. If you have a fuel pump on your business, you must be paying a pretty high, stiff price for fire insurance. How much would that business save if our ISO rating? Because he's going to pay also an increase in his property tax bill from these proposals. In theory, if we double the full-time force, there's going to be a tax increase for that.
Without the revenue enhancement from an ambulance billing service, correct.
Right, and we might save some money with overtime by doubling it, but that business owner is gonna pay more, or a homeowner is gonna pay more. I'd like to see the figures. How much more will he pay, but how much will he save on his fire insurance bill? Is that significant enough to be offsetting at all?
No.
It's not significant enough,
No.
okay.
The average homeowner with an ISO rating that drops, you're looking at maybe $200 per year for the average $200,000 household, $200,000 to $300,000 household.
$300,000 increase to double the staffing would be a $500,000 increase for that homeowner. So I'm trying to say, is there any offset to that? I don't know.
That's if their insurance company accepts the ISO.
Yeah.
You know, not every insurance company will look at the ISO rating
To base
and to base their rates on.
Okay. But they might, for instance, for a fuel station. They probably do, I would assume.
It depends on the insurance company.
Yeah. Do we have any more questions here, or do we want to open it up for the audience for a couple minutes? I think the conclusion we've come to, at least I have, is that I need to study this. We need more information, and we probably need a committee to meet several times to fill some of that out. If you guys don't agree with that, let me know, and we'll work on that part next. Yes.
One more question. And if we do transport, not saying we are or aren't, and we went down to Augusta, to Maine General, and they said, no, ship them down to Portland. Is our ambulance going to go the whole way down to Portland?
That depends on your scenario. If we've already transferred care to the hospital, then it's the hospital's duty to get the patient to Portland. If we transport and we get to the hospital, the nurse accepts the patient, signs off on it, it is no longer Winslow's problem. It is now the hospital's problem. And then they can call the private ambulance service and say, we've got a transfer for you. And the private ambulance service can come in and take the transfer, which is where the bulk of their money comes from anyways, from transfers. It's not from transports.
But if the hospital doesn't take custody,
Right.
then we're obligated. Is that correct?
Sure, it's our patient. But what are the percentages of Augusta refusing a patient?
I have no idea. That would be one thing I'd like to see some data on.
It's something they're starting to try. If you bring in a cardiac STEMI patient, they don't even take them off your stretcher. and they send you down the road to get to the cath lab in Portland. So
percentages,
not much right now, it's just a trend. It's gonna increase. It's just something I'm telling you about, so you can, you need more, you need information.
Sure, that's right, that's one thing.
That's exactly right.
Yeah.
If I could, Mr. Chairman, I would suggest, and, the rest of the council can give me straightened out if not right, I think there are two issues. One issue is staffing, and we need to deal with that, regardless of whether we transport or not. That's what I'm beginning to understand. So that, I guess, is kind of a town council working with the town manager and the fire chief type of work. It's very timely.
And budgetary time.
Because we're coming right to the budget, and that's what we're gonna have to deal with. The other piece is this whole should we transport, which I don't think, one is not dependent on the other, in my mind. One could help.
Enhance the other, perhaps, right, yeah.
But I think that's another piece of work where we.
One way or the other, we need to increase staffing
Right,
at some point.
and that's where I think the opportunity to actually go and sit with some of these towns, look at their budget, look at their experience, is a piece of work that we can do
as a committee,
coincident with, but not dependent on, the first piece. If that's correct.
Are you guys ready to hear?
Question that I got this time, and I keep jumping all over the place, is how many, you're looking at 7 people to go and to advance EMS training.
yes.
How many of those are called?
2.
2. So you got 4 that are full-time.
Yep.
And what'll happen to the other 2 full-timers?
Off with their heads.
What? No.
No, I mean,
They already trained.
no, they are not trained. They would remain at the basic level.
Okay.
Now, we have submitted a duplicate grant for another class. One of the individuals cannot attend because of the injury and will be recovering from surgery, and it's not really a good time to go to class when you're hurting. So that's why we're not 100% compliant.
And the next question is, when you put in for grants, right, could you let us know? Can you let us know?
You want me to let you know what grants we applied for?
Or that you are gonna apply for?
Sure.
So that we have an idea.
Sure. And getting back to your statement regarding the cost to upgrade to paramedic level, well, we've been pretty successful in the 3 months that I've been here, getting $55,000 worth of grant money. There's grant money out there to help pay for this. I'm not trying to ask the town to pay for everything that we want. This is why I brought up the ambulance. It's an investment, yes. Yes, I agree with you. It's an investment. Is it a risk? Yeah, but I'm trying to minimize that risk.
See, my main question was to increase your personnel from 6 to 12 is gonna cost money through the council, the taxpayer, to bring that up to a certain level.
Agreed.
And that was the only question I had, the only point I had to make.
And I was sensitive to that, and I hope I hope you understand that's one of the reasons I've proposed this ambulance.
I understand.
Transport, because I don't
offset that.
I can hear the torches and the pitchforks right now. I'm not saying
They're out there.
right, and rightfully so. Hardworking people here. And that's why I'm trying to say this works.
Yep.
And I've given you, the 27 towns of our size that it works in, and I've given you the 103 in the state that it works in. Those aren't small figures. That's substantial.
But my main concern this year is to get our staffing level to where our people in Winslow are safe. for the amount of firefighters we have.
Agreed.
I think we're all on the same page there.
One thing, can you get grants to pay for these 6 additional for 5 years?
Absolutely, I can apply for a SAFER grant.
Yeah.
But a SAFER grant is not guaranteed, number one.
Never is.
And it doesn't last forever.
Right.
So I can apply for a SAFER grant without a doubt, but that takes time to get approval on, and the window is closed for the SAFER grant for now.
Just out of curiosity, are you the main grant writer? Are you the one doing that?
I have a staff.
person that's doing that. Someone is a good grant writer then in the department.
Yes.
Okay, good.
That's
good to have that resource.
That's how we've been successful so far.
It's good to have that resource in house.
Yeah. And just because I've left the area of Plenty where there's significant grant writers down there doesn't mean that I'm not. I don't have resources that I could lean on to help write a SAFER grant. I mean,
how is the council on opening it up to some other opinions? Are we all set for a couple questions now? Yeah. Okay. First one to the mic. Anybody want to step up and have something to say? We'll give you 2 minutes. Identify yourself and your address.
I know there was a firefighter.
There was a firefighter that wants to speak.
I would like to really hear from you.
Yeah. We made you stand up and sit down once before.
I've spoken to 2 or 3 of you personally regarding this subject and in supporting of the chief, that just wanted to make it known that with all the hoopla and drama surrounding the ambulance part of this, the main objective here is to get a safe staffing level for the fire department. Okay, it wasn't to cause dissension or, strife between Delta Ambulance and the town of Winslow. It was the presentation of the ambulance was a solution to a problem. And I just want to make sure that within the council, the problem doesn't get lost, that we have a staffing issue.
Yes, thank you. Appreciate that. Anybody else?
My name is Dennis Brockway. I'm, among other things, I'm a member of the community. I also have a background in EMS. I've been in EMS for 45 years. And my biggest concern is some of the data that the chiefs presented. It really doesn't add up. To be blunt, I don't have a lot of time, so I'm not going to pussyfoot around. The budget is my biggest concern. It just doesn't add up. I mean, I'm the president of a service that is doing 25,000 calls a year. I've got a similar service in Rockport that looking at his numbers, looking at his revenue is overstated, and in my opinion, his expenses are woefully understated. So the issue of firemen, the need for personnel, that's not my bailiwick. I wouldn't begin to suggest that I know anything about that, but I do know EMS, and I would certainly caution the council to take a hard look at the numbers. I think he's used some numbers that just doesn't, quite frankly, add up. So I respect the fact that I have 2 minutes, and no offense to anybody in the room, but that's my opinion, and I would, again, just encourage you all to take a hard look at the cost data.
We appreciate that. Thank you. Anybody else like to speak?
Yeah. All right, obviously I'm an employee of Delta Ambulance. I'm a paramedic. I've worked for Delta for the past 16, almost 17 years. I've been in EMS for 22. My name is Jason Pfingst. I live at 900 Albion Road in Winslow, and I'd like to speak to you as a taxpayer of the town of Winslow, not as an employee of Delta. Obviously the two are, can't quite entirely be separated. And what it comes down to, I have the greatest respect for the firefighters of Winslow, Maine. I worked with you for years. You have saved my butt several times, okay? I respect you, and I am absolutely behind you 100% in terms of you needing more staffing, absolutely. But as a taxpayer of the town of Winslow, being asked to foot the bill for a service that is already provided makes no sense to me whatsoever. None. My mother-in-law, I moved here from the state of Vermont. My wife was a nurse at Thayer Hospital and is now a director of nursing at another facility. Regardless, we live in Winslow because that's where she grew up. This is the sort of town that I want to raise my son in. That's why we settled here, okay? But my mother-in-law, who raised my wife here, will be forced out of this town, okay, if the taxes keep going up. And I realize that the staffing, the increase in staffing will cause an increase in taxes. I understand that completely. But the increase of staffing for a firefighter EMT is not as costly as the increase in staffing for a firefighter paramedic, multiple firefighter paramedics, and all of the equipment that is necessary for the firefighter paramedics. So, once again, the point being, asking me as a taxpayer in the town of Winslow to foot the bill for a service that is already provided is stupid. I'm sorry. We have a system that works. Is it perfect? No, it's not perfect. No system is ever perfect. But it works. It's worked for 45 years approximately, okay? I am proud of the services that we provide, not only to the town of Winslow, but to Kennebec County. We do a damn good job at what we do, okay? Sorry, I get a little...
No problem.
We couldn't tell.
Tell us how you really feel.
You're making a lot of sense.
You are.
The point I want to make is, I love the town of Winslow. And I love my job at Delta. And I guess that's it. But the point I want to leave you with is, once again, asking me as a taxpayer in the town of Winslow to pay for a service that's already provided, I think is, when it comes right down to it, asinine. And I'll leave it at that. Thank you.
I appreciate your input. Thank you. Would anybody else like to speak? I would just remind people that we're nowhere near the finish line here. We will have a lot of fleshing out to do. Everything will be open to the public, and we will eventually have at least one, maybe two public hearings before any votes are taken on this. And so, just to let everybody know, we don't do anything in the dark behind closed doors. We will look at all the facts and try to extrapolate from there what our best step is.
And one of the things, you know, I can't even say enough is when you know, I've had to use the emergency services for family members. When Winslow Fire shows up, it's like, thank God you're here.
Yep.
And, you know, they stabilize the scene, whether it's a car accident, whether it's anything, it's great. And when Delta shows up, it's like, thank God you're here, yep. Because the combination of the two has been a great service for so many years. And, you know, one of the things we can't lose is that, you know, there's a lot of dedicated people on both sides of that fence that provide us with just a great service here. But times are changing. The fire call, the rescue call ratio is
Different.
switched
Yeah.
from what it was. We're getting into an advanced state of age where, you know, our population is going, and that care is a different type of care than what care was back in the time, and, you know, and we're not gonna be able to, the times are changing economically, where there's more, as we know, more pressure economically on towns, and we have to find sometimes new solutions, and we have to be open for those type of things. But in the bottom line is, you know, is when a call goes out, and people show up, what's the best care, and what can we do to make sure that the citizens get the care that they need, whether it's in the basic level or advanced level that they deserve, you know, at a cost-effective ratio. And that's what we're here. You know, we get elected to make some tough decisions, and that's what we are here. We'll always make them, whether it's plow trucks or whether we plow the road, and if we don't plow the road, somebody gets in an accident, or whether the schools, if we don't have teachers and we don't teach. Those are things that, you know, the police department, if we don't staff, you know, those are things that we make, and it's, and I'm sure with the expertise that we have here on the council and in the audience and the questions we have to ask, that we can come up with a solution that, you know what I mean, that's...
As a reminder too, we all have an email address, I believe, and we all have a phone number, and it's all listed on the town website, and feel free to contact any and all of us at any time with any of the questions, if you don't feel like stepping up to the mic tonight. Is there anything else? Would anybody like to say anything?
My name's Sue Beals, and I'm a resident of Winslow. I've spent most of my life here. I've raised my children in this town. I'm a registered nurse. I've worked in the emergency department for 20 years, and I have the utmost respect for everybody in the field of medicine. We all have our roles. I have to say that when I see somebody coming in the ER, you know, we want to provide the best care. If somebody asks me who would I get the doctor that does it 50 times as opposed to the doctor that does it once, somebody that's seen it. I find that the Delta ambulance does have and do see emergencies, and the quality of their service is unsurpassed. And I just want to say, if I'm needing care, that's who I'd want to see come to my door. No offense.
Not taken.
Okay, it's because it's personal to me, it's personal to my family and friends in this community.
I appreciate that, thank you. Anybody else? I don't want to leave anybody out if they wish to speak. There will be plenty of opportunities. We will be thinking about a committee. I'm not sure we'll make that decision tonight. We got some information, and we got a meeting in a week. Maybe at that time, we appoint a committee. We would probably ask for some members from the public. I don't want to get this committee too big, but I think someone from Delta should be represented on that committee. I would leave that up to you to make that decision, and of course, someone from the fire department will be on that committee. Probably 2 council members, maybe 3, and some members of the community, maybe a business person, homeowner, however we decide we want to structure that. And so I welcome suggestions. Emails are best, and if you want to serve on the committee, let us know, and we'll digest all that within the next week, and we'll have a meeting in a week. Do we have anything else?
Appreciate all the time and energy everybody put in.
Yep.
Thank you.
I appreciate the information you guys have provided to us. We will have a lot of work to do on our part for this. It's not going to be easy. Yes?
I'm just curious, who do we direct the emails?
Probably the town manager would be best to collect people who want to serve on the committee, would probably be the best to collect a list of names.
He's got the time. We're way too long.
But you have a council who represents you, a council member, you have 2 at-large members, and anybody will take an email or phone call from anyone. So feel free, please. The more communication, the better.